Hi, you guys. Welcome to Ask the Egg Whisperer. I wore this hat last Friday and I was having another bad hair day because, that seems to be a Friday thing. And I said, I'm just going to wear the hat again. And last week, my sister saw the hat and she said, dude, you look like a chef. And I'm like, dude, that was the whole point because I'm a omelet maker. This is my chef's hat. And of course, it has all the ingredients of a omelet, right? An egg and a sperm. So I'm wearing the hat today, you guys. So let's get started. So welcome to Ask the Egg Whisperer. For those of you guys who aren't aware of what goes on here, so basically what happens is I'm so lucky to get questions emailed to me from at asktheeggwhisperer.com, and then Paula, my producer, she'll email you when I'm going to be answering your question, and then she'll also email you a link so you can watch it later too if you're not on here live. If you're on here live, great. If not, no big deal. And now we're going to answer Jenny's question first. So Jenny says, I'm soon to be 34 and I had 3 pregnancies and then I got my tubes tied. My question is, how much should I worry about going through IVF and if it's going to work? So Jenny, here's the deal. You don't have to worry. IVF was invented for young women who have their fallopian tubes blocked, okay? You don't need fallopian tubes to have a baby put into your uterus or an embryo transferred into your uterus. You still ovulate whether your tubes are blocked or not. You can still get to the eggs whether your tubes are blocked or not. And that's sometimes something that people just don't realize. They say to me like, well, my tubes are blocked. How can you get my eggs out? I'm like, huh? I don't need your tubes. That's the beauty of IVF. It solves that problem. It solves the problem of having that embryo transport system not working. So you don't have to worry, but this is the deal. You got to know what your IVF pyramid is like, and you got to sign up for my IVF class on Monday. So on Monday, I have my next IVF class. Go to eggwhisperschool.com to sign up, and I'm going to talk to you about the IVF pyramid and what's involved with that. And I'm actually going to have the guy who invented the pyramid. I mean, he's a pretty cool guy. I totally respect all the stuff that he does in fertility and all the research that he puts out. And so he's going to be coming on at some point very, very soon to kind of break down the pyramid and how I came up with that concept. So make sure you know what I'm talking about. So your AMH level will guide you as far as potentially how many follicles you have, but you also want to talk to a doctor about your follicle count, and then they'll kind of go through what that will look like for you. Make sure the sperm is sparkling too before you do that, and make sure you've done enough genetic screening. This next question comes from TJ, and TJ says this. Are you ready for this question? I see Paris Hilton in it somewhere. What do you think about Paris Hilton's comment about using IVF to choose to have twins with selected genders? What do you think the impact of this is on the infertility community? So it's really interesting. So I have employees that I adore. They're like family to me. And they're all around 25 to 30 years old. And it's so interesting, not all of them, but a lot of them. And I find it interesting to see what headlines they see versus what headlines I see. Because I'm all infertility 100% of the time. And so I asked them, I'm like, have you heard that Paris Hilton is talking about IVF? And I think one of them actually said, who is Paris Hilton? And I was like, oh, I'm old now. No, I'm just kidding. I never think that I'm old because age is just a number. So my thought is this. For those of you guys who do not know what Paris Hilton has recently said, she basically said, I'm 39 years old. I'm doing IVF so I can have boy and girl twins. And I got to thinking, I'm like, well, I mean, IVF isn't as easy as presto and voila, here you have an IVF pregnancy with a girl and a boy twin because that's what you want. It's not as easy as that. But I think what she is saying actually is useful for people so that they can understand the power of the technology, that you can actually make plans to create embryos and have them frozen, and you can do genetic testing. You see, this is me being really positive. You can do genetic testing and find out which one's a male and which one's a female. But of course, I don't think that people should be talking about IVF like that, because the reality is that that's really not what happens. I mean, you can't choose a gender. You can only review the information and then pick one gender to put in. And the likelihood that a doctor will put in 2 the first time when you transfer, there are some that do. And I actually believe that you get one life to live. And as long as you know the risks, if you really, really want to have 2 transferred, who am I to make that decision for people? But I certainly give people all the options and share the risk with them. And then we actually do this before transfer day. We actually do this arm wrestling thing, and I've been working out a lot, so I haven't lost an arm wrestling match yet. So for the most part, when my patients say, I really want twins and that's why I want to do IVF, That rarely actually, I can't, that almost never happens. So anyways, those are my thoughts. I think that the information that she is bringing, or putting out there about herself, I find that it can be triggering for lots of reasons for the IVF and infertility community. However, it teaches people about fertility. So I'm like, more people are going to be talking about IVF and how they can use it to help themselves grow their families. And hopefully more people will be doing embryo freezing before they're 39. This next question comes from Nicola, and Nicola says, "Hi, Dr. Aimee. I'm 39 on quite a logistically complicated fertility journey. I did egg freezing at the age of 37 and 38 in New York City, 13 eggs frozen, then had a natural pregnancy in October, second month of trying with my donor friend, which sadly resulted in a partial molar pregnancy. Week 9, I had a D&C. My friend, who is my sperm donor, based in Denmark, can't travel at all, so now I'm here to embark on IVF. All tests have been done and we're good to go. Can you advise on any additional supplements I can take? I'm confused between CoQ10, ubiquinol, or anything else I should be concerned about, bearing in mind I've had a partial molar pregnancy. My AMH is 1.4. I'm trying to figure this out in the pandemic. This has been super stressful. I'm trying to keep my anxiety at a minimum while in a brand new city in lockdown that I don't know. What do you think my chances are of having success based on my history? Thank you so much. I love your podcast." So you did egg freezing, 13 eggs. That's awesome. So my question is this. It seems like you can use those 13 eggs. 13 eggs at 37 will probably give you about, I would say, probably a 35% chance of having at least one live birth. That's pretty darn good. The only thing is that I really want you to use your friend who's a sperm donor. So what's the emergency? Can we wait for him? I have a feeling that with more vaccines in May coming out, where more people can be vaccinated, you might have a chance to use him still rather than using a sperm donor from a sperm bank. So think about that first. And then the other thing you can do is, since your AMH is 1.4, why not freeze more eggs right now while you're waiting for him to come from Denmark, right? Like that would make perfect sense. So I do think that taking the CoQ10 that you're taking is great. Check your vitamin D and supplement with vitamin D if needed. Make sure your prenatal vitamin also includes fish oil. If not, take a prenatal that does. And then you can also consider what I take here. I'm going to go over to my drawer here and pull it out. So it's the True Niagen supplement, the NAD, and there are different companies that basically make it in different doses. So find the dose that works well for you. There's 100 milligrams, there's 150, there's 300, and I even heard today that there's a 500 milligram dose. I don't take the 500 milligram. I feel like 300 is plenty for me. This next question comes from Leah. Leah says, "Hello, Dr. Aimee. We're planning a fresh donor cycle with a 25-year-old. Never before donated, but had one child of her own. What would you expect the attrition rate to be at each stage in the IVF process for this donor? My tushy has been checked and totally normal. Husband's age is 43 and had a normal semen analysis with 120 million sperm, 3% normal." And then the other question is a DNA fragmentation test recommended for him with a donor cycle? We've done 2 cycles with my eggs and had success with 100% fertilization. 75% reached day 3, 70% reached day 5 and 6. The embryos were aneuploid. However, we want to optimize our chance of the donor working. What do you suggest? So Leah, first of all, get your husband on supplements. Get him on a prenatal. Okay, so that's a no-brainer. Have him take CoQ10, and why not? Just do the sperm DNA fragmentation test, right? It won't hurt at all for him to do it. It's just that extra piece of paper that says we're good. Because if the sperm DNA fragmentation is high, you have a higher chance of having embryos that are aneuploid or abnormal. You mentioned, Leah, that you did the tushy check. For you guys who don't know what the tushy check is, it's basically tubes, getting them checked, uterus, looking at your uterus to make sure there's no polyps, fibroids, or stuff like that. Sperm, we already talked about sperm and the count looks fabulous. Hormones, looking at thyroid, FSH, estradiol, prolactin, and then the Y is your genetics, making sure that your husband's genes now are compatible with the egg donor's genes. So for a 25-year-old going through IVF, each egg can have over a 50% chance of being genetically normal. I just did a case of IVF with an egg donor, 6 frozen eggs from the egg bank, 5 were genetically normal. What? I know. You're like, huh? Like, how does that even happen? That's called the power of having a younger egg. So that's why I'm just like, everybody, just get your eggs frozen by the time you're 25. No, I mean, the reality is everyone shouldn't be doing that. But I want everyone to know about egg freezing by the time they're 25, so you understand that a 25-year-old egg could have a 95% chance of being genetically normal. A 45-year-old egg has a 0.5% chance of being genetically normal. Oh, not 0.5, maybe like 1.5, but you know what I mean? And then I'm seeing all these women now, they're like, I feel so great, I look so awesome, I'm ready to have a baby, and I'm 45, and I'm like, I want you to have a baby too. And I'm going to fight so hard, even for that 1.5% chance. But ideally, I'd like everyone to be their own egg donors rather than using a 25-year-old egg donor. But I'm super excited for you. Egg donation is an amazing way of growing your family. And I help, oh gosh, I don't know how many patients a month go through egg donor cycles and successfully too. So my gut is that you're going to have a great chance. You know, your blast formation rate will be at least 50%, and each embryo will have over a 50% chance of being genetically normal. So super excited for you, Leah. This next question comes from Jen. And Jen says, is it possible to have endometriosis even if you've had a normal laparoscopy? The primary symptoms are painful periods and poor egg quality. I'm younger than 35. I've made significant changes to diet and lifestyle, but painful periods persist. And the answer, Jen, is yes. There's another condition called adenomyosis. And I'm not sure if your doctors picked up on adenomyosis on laparoscopy. So when they looked at your uterus, sometimes they can tell if your uterus looks, we use this word, it's called boggy, B-O-G-G-Y. So if your uterus looked boggy, then perhaps your doctors can share that information with you. You can get the operative report, bring it to your fertility doctor, and say, is there any chance that there was adenomyosis at the time of surgery that you can see in this report? So my recommendation is you still haven't ruled out endometriosis completely, even if you had a negative laparoscopy, unless, of course, they say that your uterus looked great and there was no evidence of adeno. But at the same time, sometimes that endometriosis can be below the peritoneal surfaces and you don't see it, and that's super annoying that you went into surgery and you were hoping to have a cure, and then you come out and you still have pain and you still have symptoms consistent with endometriosis. So the other test that you can consider doing, it does not detect and isn't used for adeno, but that's the BCL6 stain. You look at the H score, that's part of the Receptiva DX test. So consider doing that. And if you haven't gotten your tushy checked, do that. If you haven't, these are just plugs for all my mnemonics right now, but I can stop very soon. But if you're younger than 35 and you have symptoms of endometriosis, you might still have endometriosis, and we know that endometriosis is a fertility-threatening condition. So see what you can do to get treatment. You can take supplements like N-acetylcysteine, for example, and that supplement can reduce the risk that endometriosis continues to progress. Okay, next question is from Tara. Tara says this, hi, Dr. Aimee, I love your show. I want to ask you if you had any ladies that reacted badly to HGH. I was prescribed 0.45 milligrams of genotropin to prime for IVF cycle to improve egg quality, age 39 with endometriosis, AMH 2.8, FSH 10, follicle count 7. After the 8th night of taking it, waking up 2 hours after going to sleep, wired, anxious, heart racing, slight pain on the left side, normal blood pressure, and I got no sleep, barely any, for 2 nights. I felt like I could have run a marathon, okay? I stopped it. It took me 48 hours, and then I felt normal again. My thyroid's normal. Do you know what could have caused this? I'm gutted. It doesn't seem to suit me, as ladies in my clinic have had great success with it. Do you recommend anything else I could try? Of course, Tara, you can try the same thing, but go down on the dose. That dose is a big, whopping, juicy dose. So I would say take half that and see how you feel. And if you feel great, cool, stick with it. If you don't feel great, maybe do half of a half. So when someone shares a side effect with me that I haven't seen in my patients, I never poo-poo it and say, well, it's impossible that it's from the HGH. I say, well, I haven't seen that side effect in my patients before, but it doesn't mean that it isn't real for you. It's obvious that it's real for you because you stopped it and you felt better again. But you don't have to feel like you have to stop it completely. You can always restart it, but at like a much, much lower dose. So maybe start at 1/4 of that and then build yourself not back up to the original dose that made you feel like crapola, but that was fun to say, by the way. Okay, this next question comes from Mary. Mary says, hi, Dr. A. I listen to your show religiously. Thank you for everything. Thank you, Mary. My mom keeps telling me that I need to be a lot funnier. She's like, you know what? People just don't like people that aren't funny. And I'm like, God, I want to start like swearing and say things that like are totally inappropriate. But then I'm like, I just can't go there. So I'm just going to try and be funny in a clean, wholesome way, talking about tushy and balls. And that's basically the extent of it. I'm 36 years old. My husband's 38, and my sperm, or his sperm, is great. That's really fun because it rhymes. I have DOR, AMH of 1.09, FSH of 11. AFC is usually between 5 and 7. I did one IVF cycle last November, Menopur 375, Cetrotide day 7, ICSI spindle view and embryoscope, PGTA. Here's the deal. 6 eggs retrieved, 5 ICSI'd, 4 died immediately, 1 made it to day 6, and it was a 6AB low mosaic XXX. Transferred, but it didn't make it. My doctor recommended egg donor, but I want to try again with my own eggs. I changed my lifestyle, gained weight. Now I have a normal BMI. Sober. Okay. High five, like huge high five for sober, let me tell you. I'm now taking Opti-Ova prenatals, 400 milligrams of PQQ, wild yam complex. Now I'm craving yams. Thank you, Mary. And vitamin D, 5,000 units. Is there a chance the Menopur is too high and might be hurting the eggs? Would you suggest I try again with my own eggs? I really want my own eggs, or is it a waste to move to donor? What are your thoughts on taking DHEA 25 milligrams 3 times a day for 2 months and retesting my AMH? Any advice for me? I would truly appreciate it. So Mary, here's what I'm thinking. Repeat your AMH. Let's redo your FSH. I think your AMH is probably going to be a little bit lower, but it doesn't matter. I just like data. I just like the data to tell us what's going on. And I want to just share with you what's positive and really good about what's going on with you. Number 1, you had eggs. Number 2, you had one fertilized and it turned into a gorgeous blast. And it also was a low mosaic. So it's like you're so close. So this doesn't tell me to move on to donor. This tells me it might take a few cycles to get one healthy embryo. And that's okay. That's not unusual. And that's not something that makes me think we need to jump to donor right away. But if you feel like you don't want to do another cycle, which clearly you do, then let's do it. So talk to your doc about HGH. Talk to your doc about extra tests to do on your husband, like a sperm DNA fragmentation test. Talk to your doc about why the eggs died immediately. Like, what is that all about? Is it just that they didn't progress past day 3? Or was it that they actually didn't fertilize the next morning? Because there are certain things that you can also do in the lab, and maybe your doctor would agree, or maybe they'll say, we don't think in our lab that this makes sense, and that's calcium activation of the eggs to help with fertilization, and fertilization failure was the issue. And then the other thing I would say is try a different protocol. I love antagonist protocols. They work really well with me. But I also think that maybe trying something different, like maybe a hybrid type or mini IVF type protocol where you're taking Clomid or Femara. I don't use Clomid in my practice, but Femara is what I use. And then combining that with Menopur and Gonal F. So your dose of medications was great. I mean, you were on 375 units and you got 6 eggs, or you had 6 and I think 6 follicles and you retrieved 5. I mean, that's a great egg to follicle ratio as far as what you got in the IVF cycle. So my thought process is HGH, add NAD, consider the pterostilbene, get your husband on supplements too. I'm not a big fan of TID, DHEA. That's just my thing. I don't want patients taking a whole bunch of stuff, but I feel like if you want to add a couple things, adding NAD, and then make sure your husband is also not drinking any hard alcohol, not vaping, and living as healthy a life as possible. And keep going. So this next question is from Sam, okay? And Sam is saying this. Hi, Dr. Aimee. 4th cycle, age 38. Autoimmune, clotting, and poor egg quality are my issues. High natural killer cells, thyroid antibodies, antiphospholipids, factor V Leiden, and here's what I've been through. 2 miscarriages. 1 was abnormal, and 1 was a blighted ovum. Mostly blastocysts have come back abnormal or high mosaic. Prior cycle, first trigger, I got 8 out of 15 eggs were mature, 1 blast. 3rd cycle, 20 out of 21 mature, 5 blasts. New cycle, new doctor, 18 follicles, 10 mature. The doctor dismissed concerns about some hormones. 12 hours post-trigger, there were some issues, and we got 0 mature eggs. There was no increase in progesterone, so I didn't ovulate. So the question is, how common is this? Should patients know the possibility? Does the dose make a difference, and do most people respond with Decapeptyl? Any changes or investigations to do? So Sam, my thought process is this was probably a trigger shot failure, just like I think you already know. It seems like potentially the follicle sizes could have been a little bit bigger. You mentioned that there were 10 mature eggs at the time of the trigger. So you've had mature eggs before with 20 out of 21, and it seems like that was not that long ago. So I would just say there must have been something wrong with the trigger shot dosing. The trigger shot timing doesn't seem to be an issue, but dosing does seem to be a problem. It's really rare that these kinds of things happen. It's probably like 1% of the time, and it's incredibly annoying, you guys, and so annoying when it happens to my patients. Probably happens, I'm trying to think, maybe once every 2 to 3 years I get something like this, and I know that I've been so careful about all the things that I've done in advance in preparation for that retrieval. Believe me, I do a lot of prep work, labs, concentration, meditation. I put my 3 lucky socks on. I even wear my lucky hat. I don't wear this hat in the OR actually. I just wear it here on Fridays when I have bad hair days. So this next question is from Charisse. Charisse says, thank you, Dr. Aimee, for taking my question. I'm currently 35 years old. My husband's 48. We've been struggling for 6 years to start a family. In 2014, I was taking prenatal vitamins. I got pregnant, but then had a miscarriage. After that pregnancy, I got pregnant again, but had a chemical pregnancy. In 2017, at 33, we did IVF. They retrieved 4 eggs, 1 fertilized. It was not successful. This past year, I got my levels checked again, and my AMH was 0.16. My husband and I have done many things, from eating healthy to acupuncture to supplements, and then I got pregnant again. But unfortunately, it was a blighted ovum, so I miscarried. We've had genetic testing done through Myriad. We were both found to have no concerns. I also have a left block tube. At 35 with an AMH of 0.16, should I consider IVF again? What supplements? That's a better way of saying supplements, actually. I should really make that change permanently. Is it possible I could still get pregnant naturally? So, Charisse, it is possible. I mean, a pregnancy just takes a golden egg and a sparkly sperm, right? The problem is when one fallopian tube is open, your ovaries don't respond like every other month, right? It's just flip of a coin. It could be the blocked month every single month, and it's almost impossible to get pregnant when you have a blocked tube, when you're ovulating from the blocked side. So my suggestion is this. Talk to your doctor about, why is my tube blocked? Is it possibly endometriosis? Is endometriosis also what's affecting my egg quality and causing my egg age to be older than my chronological age? Because as you know, your AMH of 0.1 is on the lower end of normal for someone who's 35 years old. And it also predicts that soon you'll be dealing with something called premature menopause. It's a part of life. It happens to all of us, the M word. But the premature part, it seems like we're headed in that direction. So why? You did the Myriad test. Have you also done a chromosome analysis? Have you also done some autoimmune testing? And I know that some of the stuff that I bring up as suggestions on my show, again, just for educational and informational purposes only, aren't necessarily things standard that lots of doctors do, but there are a lot of doctors who do the tests. I feel like I should start doing like a Dr. Seuss song. Who do? You do. I do. You do. And the testing that I'm referring to are anti-ovarian, anti-adrenal, and anti-thyroid antibodies. So I find that that kind of testing could be helpful, because if you're positive, then we have an answer and a reason. And sometimes things like low-dose naltrexone or even higher dose naltrexone could potentially help. I've definitely seen it before. But I wouldn't give up on your own eggs, and I would keep showing up. I would track and trend your levels, look at the waves of eggs, and start riding them. And what I mean by that is talk to your doctor about embryo creation for IVF. Your husband's now 48 years old. Let's get some sperm frozen, okay? Let's get some on ice. And wouldn't that be nice? Check a sperm DNA fragmentation test. That's what I just do pretty much on, not everybody, but on most guys who are over the age of 40. And also if you had a history where you had 4 eggs and 1 fertilized, especially if, let's say, all 4 were mature. So you guys sound like you're doing all the right things. You're taking supplements, you're doing acupuncture, eating healthy. And I would suggest asking your doctor the questions that I just brought up. Is my tube possibly blocked from endometriosis? Could doing a surgery at some point help improve my chances? Should I be considering donor egg IVF at some point? If I have a sister, I'm just planting this seed. Should we get her AMH checked to see if she can freeze eggs for me and sign up for Aimee's freezeandshare.com program? That's kind of what I would consider doing. But in all seriousness, when someone has a sibling and the sibling is younger, I don't necessarily say, oh, we should use that sibling's eggs. I say, let's consider that as an option for the future. And just to have them just feels good. And so I hope that maybe some of the suggestions I made will help you. This next question is from Carrie, and Carrie is saying, "Hi, Dr. Aimee. Thank you for sharing your knowledge. I'm almost 38, diagnosed with DOR, December 2019. My AMH was 1, FSH was 12, and then a year later, my AMH was 0.3, FSH was 20. Does this rapid drop-off seem off to you? My doctor thinks that my levels in 2019 were wrong. Here's a little background. In 2016, I had a pregnancy and a miscarriage at 8 weeks. At 2017, I had a pregnancy and healthy baby. In 2019, my pregnancy ended due to a severe genetic diagnosis. Then March of 2020, I had a miscarriage at 4 weeks with no issues, with no genetic testing. In August of 2020, first round of standard IVF, I had 7 days of stim, only 1 follicle remained. We converted to IUI, got pregnant, and then found out the pregnancy had trisomy 15 after I miscarried. All the testing, recurrent pregnancy loss, karyotype, semen analysis, carrier screen, Stanley sonogram have been normal. I'm about to begin mini IVF. You guys, Carrie is like kind of badass. She's just like, I'm not letting anything get in my way. I'm going to continue to grow my family my way, and hats off to you. Not this hat, because I have bad hair day. I'm keeping this hat on. My chef's hat. My mom-let maker hat. Or I should say my mom-let maker hat. My mom-making hat. I'm about to begin mini IVF, Clomid 50 milligrams for 5 days, gonal F 150, Menopur 75, Ganirelix, and HCG trigger. Any insight would be so appreciated. Carrie, I agree. You have decreased ovarian reserve. But clearly your eggs like your husband's sperm, and clearly even if an embryo is abnormal, it likes to stick in your uterus. So let's talk about the positives. The positives are your uterus is receptive to basically any embryo that practically goes past it. So that's not a bad problem to have. But the egg quality issue is something that I'm just not sure that we're able to overcome given everything that you've been through. But because I'm the most stubborn person, I'm probably more stubborn than anyone that you've ever met. I was going to say, not meet my husband. One day you'll meet him. I was going to say, ask my husband. The other day I was talking about, the Aimee sauce, and he's like, bring home some of that Aimee sauce. I'm like, honey, no, I'm not bringing home gonal F and Menopur. So my suggestion is to talk to your doctor about the cycles that you're starting and how many eggs you expect, and at what point do you really move forward with the cycle or not. And you guys hear me talking about riding the waves of eggs and making sure that you have a really good wave before you ride it, and consider other options like mid-luteal phase stimulation, even a duostim where you start stem, retrieval, start stem, again in cases like yours, Carrie, where the follicle count is really low and you want to take advantage of every single egg that comes your way. Yeah, that's what you want to do before the waves stop coming in. There's a point, I know I'm going somewhere with this analogy, where the sea of egg waves is still, no more waves. And so it's like you want to catch as many waves as possible where you're in a situation where you know that, in the next 6 months or so, the waves might not be coming in as often. So my insight for you, same stuff that I often say is see if your doctor will consider Femara over Clomid because the side effects are better. See if your doctor might want to consider more Menopur than gonal. I feel like it might help with better embryo quality. I love Ganirelix, I love antagonist protocols. And the other thing with your HCG triggers, sometimes in patients who have DOR, which is decreased ovarian reserve, adding Lupron as part of the trigger can sometimes help. Okay. We have someone that I love named Dr. Renee Hilliard. She is also an OBGYN and sex therapist. I posted 2 blog articles today, I think, or this week, as a matter of fact, and she's been on my podcast recently. She is saying hi to me right now on Instagram. Hello, Renee. I love you. Okay. So this next question comes from Samantha, and Samantha says, hello, Dr. Aimee. First of all, thank you for all you do. I recently found you after a friend sent me your Instagram account to me. I've been trying for 2 years. I've been working with a clinic in Boston, 2 separate doctors. I switched to one, then went to the other, and I was diagnosed with DOR. I have had 5 medicated cycles with only 3 full retrievals. The other 2 were canceled, 2 transfers, only 1 ending in a chemical pregnancy. Beta was 42 at the first check. Now, with the new clinic, however, recently I've been getting a period every 2 weeks. And since December 2020, I do have a cyst in my right ovary. Could this be why? I don't want to move forward with this cycle for it to be canceled again. I'm 31, husband is 40. He had a reversal 3 years ago, which worked perfectly. The doctor said his sperm is more than adequate. My AMH is 1.04, FSH 4 before it was 18. Recently tested. It's been tested 6 times. Everything else tested normal. I take CoQ10, vitamin D, prenatal melatonin, and Serovital. What else could I test 4. So Samantha, your history of having an FSH of 18 tells me a story. It tells me, pay attention to my eggs. And the question is, why are your eggs doing this? You're only 31, so make sure you've done enough genetic screening, karyotype, carrier screen, look for Fragile X, look for some sort of chromosomal abnormality. Chances are you don't have them, okay? The likelihood is probably less than 1%. Well, maybe like 1.8%. So I still think when you're putting your body through all this stuff, just doing more testing makes sense. So you want to ask your doctor whether your follicle count corresponds with your AMH level, meaning like, does your AMH level tell you the story here? Because I think knowing what your updated AMH and another FSH estradiol and your follicle count, I think all that information will help guide you as far as which cycle is a good one to go with and which one isn't before you start your cycle. Like I wish there was a test that you could do because you said you already had done 2 canceled cycles, or you had already started 2 IVF cycles and 2 were canceled. Like I wish there were tests that you could do at the beginning that said, stop, freeze, no IVF. Unfortunately, sometimes you just got to go with the flow, and then you find out that it's not a good cycle after your first or second monitoring appointment. And that certainly happens to me. It's not something that I would call rare. It's not super common, but I would say probably less than 5% of cycles that I start end up being canceled. And the reason is I'm super picky about what cycles I start. And what I mean by that is when the patient comes in, we look at her hormones like her FSH and estradiol. We want to make sure that her estradiol at the start is less than 80. We want to also see that the FSH is on the lower side. If your FSH levels have been like 999, all of a sudden you have an FSH of 18, maybe that cycle is one that you should wait out and maybe wait for another cycle. That's kind of based on like stuff I do, but doesn't necessarily mean that this is stuff that your doctor has to do. And you guys all have heard me talk about all the egg quality supplements like HGH, NAD, stuff like that. So do start taking that if your doctor agrees. And then consider more of a mini IVF approach. That might be another way of doing things. And the fact that you had an embryo, even though it resulted in a biochemical pregnancy, still gives me hope that you still have a chance of being successful. And why? And the why is because you're 31 years old. And don't count out the sperm as being a part of the situation. And, whenever there's, some sort of, situation, I'm not sure what the word should be, you guys. Situation seems like a fairly benign word. I don't like words like, I hate words like failure and stuff like that. So I try and stay away from them. But we'll talk about a sperm situation, right? He had a vasectomy and then a reversal. That's a situation. So my thought process is to still consider doing a sperm DNA fragmentation test and see what's going on there. And there are a whole bunch of other tests that you can do on sperm too. There's Path Fertility, really cool sperm chronological age test, sperm versus chronological age test. There's also, what else can you do? The sperm aneuploidy test, right? So that's through iGenomics. So I don't know that you necessarily need them, but I'm just talking to you about other tests if you're in a sperm situation. Not that you're in a situation, but you know what I mean. This next question comes from Victoria. Victoria says, hi, Dr. Aimee. I'm 30 years old and my husband's 34. We have been diagnosed with male infertility, low motility, morphology, and count. Nothing could be found on my side. Tubes and hormones are fine. CD138 is negative. NK cells normal. Thrombophilia screen fine. AMH 4.79. No issues with thyroid hysteroscopy done. We had 4 IVF cycles, 3 transfers. All 3 transfers ended in biochemical pregnancies. My last transfer with the PGS normal embryo, 2. We have 2 more euploid embryos on ice, and my doctor wants me to take it looks like Neupogen on the next transfer. What's your opinion on that? Do you think I should try a different protocol using steroids? Last time I was on a blood thinner, baby aspirin, progesterone injections, and tacrolimus. Thank you for all you do. So, Victoria, I would ask your doctor if they could do the ERA test and the Receptiva DX test on you. Run you through another dummy cycle. And dummy, I know, a cycle of pretending is what I mean by dummy, like a mock cycle where you're pretending like you're going to do a transfer, but you're not. Instead of transferring, your doctor's going to extract cells from the lining of the uterus and send them off to a couple different companies to learn more about what is going on. I'm curious about your fallopian tubes to see if there's a hydrosalpinx. I'm curious if this is due to endometriosis or adenomyosis. So you said 2 euploid embryos left. And so before you use them, make sure you've gone through the 3 questions. What do you want? What is it going to take? And are you willing to do it? So I would strongly suggest rethinking transferring also right now, and maybe consider one more IVF cycle before you transfer. And talk to your doctor about your embryo quality. Maybe the embryo quality has something to do with it. I mean, if they were all like CB or BC or B minus, B minus embryos, that could be the reason why the embryos weren't implanting well. Quality does matter. Okay, when you walk into a diamond store, they're not like every diamond here's the same price. Like, same thing with embryos. You never will say every embryo here has the same live birth rate. It just doesn't work that way. And if there's anyone that's telling you that they do, call me. Or have them call me. I promise you they won't call me. But thank you, Victoria, for that question. Okay, this next question. Oh, now I know what's going on. I don't know if you guys have noticed. I keep hitting the phone because it keeps going out. And then I just noticed, I think it's because my AirPods are somewhere and they're causing some funniness here. So I'm going to fix this so I'm not dealing with note to self. Make sure AirPods are secured before you start your Instagram Live. Okay, next question is from Rupa. Rupa says, hi, Dr. Aimee. Hi, Rupa. I'm 32 and have had 3 natural miscarriages before 10 weeks. The second one was a blighted ovum, trisomy 4, and the third one tested normal karyotype. I got all my tests done in the last few weeks under your Angel method. Love you. And my AMH is 1.19, FSH 7, follicle count 11, prolactin 7, my husband's sperm analysis, and fragmentation all normal except 2% morphology. Both of us are taking supplements recommended on your website since January 1st. My HSG showed that my left tube was blocked, some possible polyps, and likely endometriosis. You are a badass, Rupa. You're like just going for it and making sure that you are just doing everything you can to get to a diagnosis and the root cause, and I love it. I'm scheduled to meet a doctor for laparoscopy hysteroscopy for endometriosis, and he's one of the world's most renowned endometriosis surgeons. What do you recommend? IVF egg retrieval first or get the laparoscopy done first? Really looking forward to my consultation with you. Yay, I get to see Rupa. I get to see Rupa. Is there a quality concern either way? Okay, so Rupa, this is the thing. I mean, your AMH is pretty good. You're 32 years old. The only reason why I would say it makes sense to do the surgery first is if emotionally, this is the thing. If your fallopian tube is blocked and it's filled with endometriosis, it's going to be better, potentially, to remove that tube. He might go in and be like, oh, both tubes look like there might be an issue, even though you're getting pregnant in your uterus. What if you wake up with no tubes and no embryos frozen? I find that emotionally, it is a lot better wake up from surgery knowing that you have embryos waiting for you. So unless you have big endometriomas on your ovaries, my suggested strategy would be IVF, surgery, transfer. However, if you did surgery and you were okay with waking up with no tube attached, then you can certainly do surgery first, but I'm thinking that maybe doing IVF surgery transfer is better than, I feel like this is one of those like, where's the ball games? Find the ball under the cup, but you know what I mean. I think you're doing everything right. Be sure to take CoQ10, be sure to take N-acetylcysteine, be sure to take a prenatal with vitamin D and fish oil, and then I can't wait to see you. Strong work with everything. This next question comes from Abby, and Abby says, you're amazing for sharing your knowledge and smile. That is true. I smile. My mother doesn't like anything I say unless I smile. So I was like, hi. Ever since I was little, I used to run track. I was like the slowest runner ever. And she would just scream, not win, like run faster. She'd just be like, smile. Isn't that cute? Gotta love her. Okay. So here are my stats. Cycle day 3, TSH 1.62, AMH 1.5. Prolactin 21, estradiol 16, FSH 8. Clomid challenge test done, and my cycle day 10 labs, FSH 8, estradiol 175, HSG, saline sono clear. I've had 3 failed IUIs, 2 egg retrievals resulting in 9 embryos total, 1 fresh failed, 1 frozen resulted in a chemical, and 1 frozen worked. Yay. But trisomy 18 and ended the pregnancy at 18 weeks. I'm devastated. I've had 3 frozen untested day 6s, 4BA, 3BB, 3BB. Our day 6 is bad. The answer is no. Your day sixes are not bad. The 3 frozen, they're untested at 4BA, 3BB, 3BB. Given your statistics, I'm not sure how old you are. I can't tell based on what you've shared with me so far. Abby, if you're there and you're watching this right now, please enter your age. Is Abby there? Is she watching live? No, I don't see that Abby is watching live right now. So let's just give you an age. Let's say Abby is 35 years old. So I would say of those 3 embryos, probably 1 at least will be genetically normal. Day sixes are not bad. Day sixes are almost just as good as day fives. I think Abby just messaged, I'm 40. So in that case, Abby, if you're 40 years old, I would say, let's do another cycle. Let's do another cycle. I mean, we know that this is an egg quality issue and it's just related to your age. It's devastating, don't get me wrong. But we got to be real about the likelihood of success with each blastocyst, right? So each blastocyst at 40 has about a 25% chance of being genetically normal. Having 3 means probably 1. I want you to have at least 2 kids. I actually want you to have like a bunch of kids. And oh, you put it right there. I'm such a numbnut. If I just read a little bit longer, I would have gotten to your age. What a moron. Will testing my frozen embryos damage them? What should I do? I just want 1 baby and I'm almost 41. Thank you so much. You really are a bright light in this very emotional journey. Okay. So if you just want 1 baby, I would talk to the lab director or have your fertility doctor give you this information. This is the stuff that I do too. Is I would, because we don't have time basically for another miscarriage like that. Like no one has time for even 1, but at 41 we don't have time for that. Like that's 6 months out of your fertile life that you can never get back. So you have to ask your doctor, what experience does your lab have with thaw, biopsy, refreeze, and how does that affect the pregnancy rate and outcomes of those embryos once you do that? Some people say no difference. Other people say in our lab, it reduces the live birth rate by about 50%. So you want to know that up front. And those are the questions I ask of the lab directors when I make decisions like this. I look at the embryo quality. I ask them what their experience is, how they feel about doing that. What do they think? And if the answer is thumbs up, we go for it. The answer is thumbs down, we don't. So your embryos aren't completely hatched out of their shell. It looks like they have some more expanding to do. So they, based on what you've shared with me, look like really good candidates for thaw, biopsy, refreeze. You'll get results a week later, and then you'll have an answer as to what to do next. Do you have to genetically test them? No. If not, maybe consider transferring, I know you guys, all 3. All 3. Put all 3 in together. I would not have a hesitation to do that just because I know that at 40, 41, the likelihood of all 3 being normal is super low. The likelihood of 2 being normal is also really low. So by transferring 3, I'm not giving you a chance of having triplets. I mean, probably like 1% potentially. Don't have triplets, please, Abby. But my point is that knowing that you want 1 baby and given your age, I feel like we're in this situation where we have to just kind of weigh our options. And, doing more IVF, I'm not sure it necessarily makes sense because you have these 3 really beautiful embryos and you've been pregnant. So that's really great that your uterus is as healthy as it is. So I hope that helps you. This next question is from Heather. And Heather is saying, I have premature ovarian failure and my husband has male factor infertility with sperm mobility and motility issues. We're doing donor egg IVF with ICSI and recently had devastating news. The morning of our transfer, we got a call that all 8 of our embryos stopped growing at 6 to 8 cells. My husband had multiple semen analysis and genetic testing. The clinic said the eggs looked healthy and we are at a loss. They're at a loss. What would you recommend we look into? I don't want to give up hope, but I'm so heartbroken and terrified to start all over again. Heather, I don't blame you. It's almost like having PTSD all over again from all the stuff you've been through and now with the donor egg when that was supposed to be like the cure, right? And then you go through that and there's not a single embryo to transfer. So I'm sorry you've been through that. So I would have your husband do a chromosome analysis, a sperm DNA fragmentation test, testosterone level, see a urologist, check under the hood. I mean, you've been poked and probed how many times? Just let him just get poked and probed just a little bit to see if there's anything like a varicocele that could be affecting things. So talk to your doctor about including the official reports and some sort of, make sure you're getting all the official reports is basically what I'm saying. And official reports related to the semen quality on the day of the thaw or the egg retrieval. It sounds like it was pretty good, but you just want to make sure that there are no surprises there. And then believe it or not, I mean, it could be the eggs. I mean, I think I've had it happen maybe once in the last 13 years. And I actually remember that day quite well. It was pretty horrible where there were no embryos that progressed from day 3 to day 5. It was a first time egg donor. and she was, I think, under 25. So it's very, 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 very rare to happen. So it could still be the eggs and not the sperm. And then maybe next time it might not be a bad idea to consider working with an egg bank that has some sort of live birth guarantee. There are egg banks like that out there, and so that might be something that's more comfortable for you to work with, a program that would have that situation for you. That apparently is my word of the day, situation. So you're not in that situation. Okay, this next question is from Evelyn. And Evelyn says, hi, Dr. Aimee. Thanks for all you do for the IVF community. It's selfless and genuine, and for that I'm grateful and a loyal listener. I'm 40 and beginning my 9th round of IVF. I have you guys, did you hear that? Her 9th round of IVF? Okay. I have a 2-year-old son from my first cycle. I know you guys all heard that. I got 1 frozen embryo from my second cycle. I haven't gotten a healthy embryo since. I'm trying to bank 1 more embryo before transferring. I got my Pfizer vaccine on January 27th. I'm due for my second on February 17th. That second vaccine will fall midway into my egg retrieval cycle. I've heard most people are reacting with fever, aches, and chills after their second vaccine. Would you suggest I get my vaccine during stims, or should I wait until after I retrieve? I'm doing a freeze cycle. I worry that it's going to be a lot on my body and could affect the outcome of my cycle thing. So Evelyn, I'm thinking that if you did really well with the first shot, you're probably going to do pretty well with the second shot. I think people who had really bad side effects with the second also had some pretty bad side effects with the first 2. So talk to your doctor about their recommendations. I know there are some clinics that recommend not doing a vaccine within 7 days of some sort of egg retrieval or transfer, but I always make it more like personalized decision, individualized, after talking to the patient about what happened with the first shot, what type of shot they got, whether it was Pfizer or Moderna. And I always talk to my patients about pre-treating with Tylenol, taking Tylenol around the clock for the first 48 hours, and NyQuil, you guys. That is a secret weapon for getting through the shot side effects. So NyQuil at night will help you sleep, and you won't wake up sweating from fevers and chills. So I hope that helps, Evelyn. Let's see here. This next question is from Mary. Mary says, hi, Dr. Aimee. I love your show. I'll be taking cabergoline 0.5 milligrams on trigger day a few hours before the shot. Could that affect egg quality or quantity or maturity? The last FSH shot is on Friday morning. On Saturday in the morning, I'll take my last ganirelix shot. Will the follicles continue to grow until retrieval on Monday morning? If yes, how fast? The dominant follicle on Friday is 20 millimeters. Thank you for your help. So Mary, I use cabergoline as well. I use it to prevent ovarian hyperstimulation syndrome. My patients have a really good physical recovery after egg retrievals, especially my patients who have over 15 eggs in whom I give them cabergoline. I also give them Femera as well. I also do ganirelix as well the day before the egg retrieval or on the day of the trigger shot. So it sounds like your doctor is doing all that. I haven't noticed that any of that will affect egg maturity, egg quality, and your follicles will continue to grow after the trigger shot as well. This next question is from Fan, and Fan is saying, hi, Dr. Aimee, I'm 31 trying to conceive my first baby. I had 2 ultrasounds 7 months apart. The first ultrasound was done during my fertile week. The result came back normal. Uterus size was normal. My lining was normal. Second ultrasound, they told me I had adenomyosis. And that was only 7 months apart. Enlarged uterus, lining 15 millimeters. I don't have any symptoms of adenomyosis. I don't have long periods. I don't have painful periods. I have been experiencing some lower back pain. How does a uterus grow that big in just 7 months? Do you think it could be a misdiagnosis for adenomyosis? So then, I would say maybe do another ultrasound at a different time of your cycle, perhaps at the start of the cycle or after your bleeding is done, and then compare the sizes. So maybe there's some sort of subjective element to this scan, and maybe go back to the person who did your first scan and have them do the ultrasound for your third ultrasound to see what they think. And so my thing is that, I find that, what's that saying? Knowledge is power, and information can just guide you as far as what you should be doing next. And it's not necessarily a bad thing to have this information right now. If indeed your uterus is growing from adenomyosis as fast, we got to do something about it. And we know that adeno can affect implantation. It can increase risk of having preterm labor, preterm delivery, miscarriages, and other pregnancy complications. So you might want to be a little bit more aggressive as far as what your plans are for baby making. What I mean by that is perhaps freeze embryos so that you have more options in the future, especially if your adenomyosis gets worse, and especially if this means there might be endometriosis too. And the other thing to consider doing is maybe being more aggressive with treatment. So I'm not sure exactly how long you've been trying, but check your fallopian tubes and ask your doctor to maybe consider doing something like giving you Femera and potentially IUI if they think it's indicated. But definitely check your fallopian tubes, because if you're having symptoms of adeno, potentially there's some endometriosis outside your uterus too that could be blocking your tubes. Okay, this next question is from Aurora. Aurora says this: hello. I would appreciate any recommendations in my case. I'm a 33-year-old with a history of infertility of 12 years, Hashimoto's, diminished ovarian reserve, 1 spontaneous pregnancy with femera, and with a ruptured ectopic. I'm laughing right now because there's a whole bunch of turkeys right outside my door saying gobble, gobble, gobble. I think they want to be in on the Ask the Egg Whisperer right now. I was then told I had low ovarian reserve at age 27 and underwent IVF with my own eggs and got 5 embryos from 5 eggs retrieved. I had 1 fresh transfer which ended in a spontaneous miscarriage, frozen transfer in December 2017, and then we lost that pregnancy due to placental abruption, and then had a failed transfer after that. Then did donor egg IVF, got 11 eggs, 9 embryos, 7 normal, had 1 single embryo transfer, and that also failed. The next one was in January 2020, 2 embryos transferred, and then had a miscarriage at 5 weeks. I have 4 embryos left. My doctor doesn't think there's anything else we can do to change the protocol. I am so scared to do the same thing over and over and over again. My ERA, receptiva, clotting blood work was all normal. Aurora, I agree with you. It is so hard to think that you would do the same thing again and you would get a different result. So this is a story that I see in patients who have adenomyosis. This could also be a story of an anatomic issue in the uterus. So here are the things that I would suggest that you guys consider doing. Number 1, let's look at your fallopian tube. You had a ruptured ectopic, so I'm wondering what's going on with the other tube. Number 2, even though you had a receptiva BCL6 score, that sounds like it was normal. Let's treat it as if it's positive. Maybe consider 1 to 2 months of depo-lupron before you transfer. Ask your doctor, have you ruled out a uterine septum? Have you ruled out scar tissue in my uterus? Have you ruled out adenomyosis? Should I have another laparoscopy, hysteroscopy before another transfer? I would probably be doing those things for you if you were a patient of mine. A laparoscopy, hysteroscopy, 1 month of depo-lupron, then transfer. That's kind of what I'm thinking would be maybe a new thing, different thing to do for your protocol. And then also, even though all your workup has been totally negative for thrombophilias, there are some doctors just like me who would consider using Lovenox empirically, meaning there's no evidence at all that you need it, none at all, just that things just aren't working, you're having issues, and we're in a situation. So when you're having issues and you're in a situation, even though all the clotting blood work has come back normal, I'm thinking, let's just pretend. Let's just say that there might be a test out there that we haven't even heard of. It hasn't been invented anymore. It hasn't been invented yet. But you are positive for that test. I can't give you a paper to show you that you have it, but real life experience is saying maybe we pretend that you do. And so maybe taking Lovenox empirically could be helpful. I've had cases just like yours where I add it and that's what works. So I hope that some of these tips will help you, Aurora. You've worked so hard for the last 12 years. You're only 33 and it's so painful to hear you. I mean, I don't hear you, but I feel like I hear you, and you still have so much hope in your heart after everything you've been through. You went then did donor egg, and you're still having the same issues, and so my heart hurts, and I just want to help you however I can. So I can only imagine how scared you are right now. This next question comes from Emily, and Emily says, so Emily, I have to share something funny with you. So my dad's name is Emil, and he retired in April, and he's delivered almost every single baby, or every kid in this community practically. And so I say Emily with just love in my heart because he's a male, and as you know, I'm not. And when he was in practice, I used to refer all my patients to him. And my patients would say, well, I want a woman doctor. And I would say, well, call him Emily and he won't mind. He used to tell his patients that, my name is Emil. And he talks like that. And he says, call me Emily if you want. You know, that's kind of cute. So, hi, Dr. Aimee. I love your heart to educate and help people. Thank you. I have a saline sono this week to check on a small size, almond size fibroid in my lining. It's better than calling it something else. I anticipate the doctor will suggest removal, and after removal, how long do I have before it grows back? I've heard fibroids return, and I'm concerned if it will impact our chances for IVF. So Emily, similar question that someone asked earlier, what's first? And I feel like I should take these cups and like move them around and put the little almond underneath them and say, find the almond. But I'm not going to, because then I'll get dizzy and not sure where the almond is. So my point is this, IVF meds stimulate fibroid growth. If you're a fibroid maker, And I've had patients that have done that to me before. It's like, remove it again. Oh my God, another one. Another one. See what I mean? So my suggestion, you're already considering IVF. Let's just do that first. IVF, freeze embryos, remove the fibroid, then transfer right away. So you're not doing fibroid, IVF, fibroid, then going into a transfer. So it might be more efficient that way. So talk to your doctor, see what they say, see if they think that they should do it that way. Okay. Last question that you guys have emailed to me for today from Sarah. Sarah says, love you and your show. What would you advise next for me? I'm 36 years old with DOR. My AMH is ranging from 0.2 to 1.05 this year. I've had 2 failed conventional IVF cycles, 225 of gonal and 225 of menopur. Cycle 1, 7 eggs, 0 fertilized. 5 atretic. And cycle 2, 5 eggs, 3 mature, 2 fertilized, but did not make it to blast. Should we try again with mini IVF and a day 3 transfer, or is it donor egg time? So, Sarah, again, I swear to God, I don't know what it is about my special sauce. And honey, I'm not bringing home the special sauce. The special sauce is not something that you want at home because it's not that, it's not the special sauce that he's thinking of. My point is that if you haven't tried the supplements like NAD, higher dose CoQ10, pterostilbene, add HGH to your protocol, thinking about the waves of the eggs and when you should ride the good one, definitely consider more IVF. And I think that being open to all possibilities for how you're going to grow your family is exactly how I want you to start thinking, just so you don't have the anxiety. Obviously, it's still anxiety provoking, but just knowing that you're going to be a mother one way or another, and it might not be with your own DNA, and that's okay. Just kind of helps us throughout this process. And it sounds like I have a feeling that you probably have a pretty good fertility team already as far as a therapist and all that kind of stuff. So if you don't, go to fertilityteam.com and you're going to read all the resources and recommendations that I have for my patients. But I would certainly think about building that team if you haven't already to continue to get through everything that you've done. But my concern would be, are we missing anything sperm related? It sounds like we may not be. You did conventional IVF, and I would say probably next time consider not conventional, but ICSI and maybe even Zymot with Pixie. And then as far as the day 3 transfers, sure. I don't know that day 3 transfers are any better or worse than day 5, but it just depends on what your priorities are. If your priority is to just get an embryo inside your uterus as soon as possible, and I know it's like, who wouldn't have that priority? But the benefit of waiting till day 5 is just getting more information about the embryos so that you actually know if it's able, if the embryos are strong enough. But ask your doctor, because every lab's going to be a little different and every doctor is going to have a slightly different recommendation. So if your doctor is saying, I think for you, day 3 transfer makes the most sense, then I would go with their gut feeling as well and do exactly that. But I feel like adding ICSI or Pixie with Zymot potentially, thinking about all the egg quality supplements, consider a mini IVF approach for sure is exactly what I would think as well for your case, Sarah. You guys, I love being here. It's Friday night. What a night. Let's see here. My husband has a salad with chicken waiting for me at home. Isn't he the best? I freaking love him. Love him, love him. Today, as I was driving to work this morning, my car went beep, and I was like, uh-oh. It didn't make a sound like that. It was more like, you're about to run out of gas. And you guys, he came to work, took my car, went and got gas and brought it back. Isn't that a nice guy? Okay, so here we go with the questions. I'm taking NAD. Should I also take resveratrol? And the answer is yes. So is resveratrol. Ooh, I swear there's only coffee in my cup here. Resveratrol is very similar to pterostilbene, so either or, but I would say if you have resveratrol at home, start taking it. NAD is not the same as resveratrol. Next question. Hello, my first FET failed. My embryo was genetically tested. My estrogen and progesterone levels were normal. My lining was great. Anything different I can do for my second FET so my baby will stick? So yes. So talk to your doctor about making sure your cavity is normal. You've done preconception labs looking at your thyroid and vitamin D and prolactin, for example, and then look at your, history of why are you even here? Why did you guys do IVF? Is it because of endometriosis? Is it because one tube is blocked? Is it because, see what I mean? And then make sure you've dealt with those things as much as possible. So if it was endometriosis, if it was a tubal blockage, if there's something you should do about that situation before you enter your transfer situation. I'm trying to say the word situation as much as possible. Can you recommend any fertility specialists in the Austin area? Actually, I don't think you can go wrong with any of the docs in the Austin area. Dr. Shar Kavusi, Dr. Dan Lebovic. Those are my guys. I went to training with them, and they are super fun and super smart and super good at what they do. Dr. Kavusi's brother, also Dr. Kavusi, is a male fertility specialist and very well known about the work that he does to make sperm sparkle. Okay, next question is Chaita. What supplements have you seen work for egg quality in clinical practice? Any evidence for NAD? Yes. I mean, look at me. I'm like 95 years old and I take NAD and I look like I'm 20. Yeah, so there is a lot of evidence that I think it works. Okay. My husband has low motility morphology. Is there anything he can do or supplements he can take to help improve his motility and morphology? So yeah, the same stuff that we talk to women about, like prenatal vitamins, vitamin D, fish oil, CoQ10, NAD. Guess what? Guys can take too. Prenatals are just a multivitamin with a pink label most of the time, but guys can take a male prenatal as well. You can also go to Theralogics. They have Conception XR. Natalist has a prenatal for men as well. So let's see here. Thoughts on PRP, ovarian rejuvenation. Does it help with DOR? Is it worth it? So I really want more evidence to say that PRP is worth it. I have had a patient do PRP. She was menopausal, 47 years old. She got her PRP. I retrieved, I think, 2 eggs from her. I got 1 embryo. It almost made it to a day 5 blast. Like so wanted to, but then by day 6 it stopped growing, and that was soul crushing. I really wanted it to work. So I haven't seen it work yet for anyone in my practice. Does that mean that it's not going to work for anyone ever? No, it's just that I haven't seen it work yet. Let's see here. Is there any issue with starting stim on day 3 versus day 2 or strict day 2 and why? So I'm more of a day 1 or 2 stim start, not day 3, but day 3 is still fine by me. What do you recommend to build healthy follicles? HGH, NAD, pterostilbene, high dose CoQ10, vitamin D, and fish oil. My AMH is 2.3 DOR, but everything else is good. Male factor infertility, so we did ICSI. I had a uterine polyp removed. We have 3 embryos on ice, hopefully FET next week. Tips. So I would say maybe consider, it sounds like you're doing everything, maybe consider acupuncture. IVF after 40 says, hi, Dr. Aimee, I'm 43 on my first IVF cycle. I'm on my 7th day of stims. My doctor saw 15 follicles this morning. We got super excited. My blood test came back with high progesterone triggering tonight. Are there risks that I'm going to lose eggs this time? What are your thoughts? So this is the deal. When it comes to progesterone, sometimes it's not right. So clinically, if everything looks good and your progesterone is high, you may not be ovulating. Have your doctor add on an LH level, do a ganirelix or a cetrotide on the night of the trigger, and then go from there. I'm not too worried about it. Next question, what do you think about dual stem? Does it improve the chances to have more eggs retrieved? The answer is yes. I think it's a really great way in patients who have a low egg count to still get eggs when you can. Next question, Dr. Aimee, does a high estradiol level affect egg quality? My level was 7,800 with 14 eggs between 21 to 16. My egg retrieval will be tomorrow. And I would say that's I don't call it controversial. I mean, I've heard people say that high estrogen can affect egg quality, but I don't necessarily think that that's always true. So hopefully in your case, you're just going to have gorgeous eggs that turn into even more beautiful embryos. What protocol would you do with a 42-year-old with DOR and first-time IVF? Husband is 40, has a varicocele, but doesn't seem to affect his semen analysis, which is fine. So I would say still do a sperm DNA fragmentation test. If the sperm DNA fragmentation is high, you're going to need something like ICSI or PICSI to bring that DNA fragmentation low to make your embryos sparkle. Otherwise, it's going to be super annoying to get embryos that are normal and then don't stick and grow, or you have miscarriages, and that's just something that can happen when you make embryos with sperm that has high DNA fragmentation. My protocol for a 42-year-old with DOR would just depend on the number of eggs you have, but typically I'll use a combination of Femara, Menopur, Gonal, Ganirelix, and HGH and go from there. Next question is, I'm in my 40s. Why would my doctor add Clomid to my medication? Are there side effects? I don't know. I don't like Clomid. I think it's gross, but just because I think it's gross, your doctor may think it's awesome. So ask your doctor, why are you putting me on Clomid? Dr. Aimee calls it Clomonster, and she says that I have to have my exorcism already scheduled for when I'm done with it. But honestly, Femara can make people feel a little cuckoo too. So everyone's different, right? So I tell my patients, if you feel like you need an exorcism at any time, call me and I'll talk you down and we'll go through the motions of extracting the demons. We'll come up with coping mechanisms and a way for you to get through it. But the reality is that some people just feel horrible on Femara too. So what I tell my patients is no matter what the dose, there are always adjustments that we can make. If 4 pills per day, for example, make you feel a certain way that you don't like, we can actually adjust it and go down to 3, or you can take 2 in the morning, 2 at night, or you can even split it up more than that, like 8, 12, 4, and 8. So there's so many things that you can do to adjust things if you're feeling like crap. I said it. Crap. Okay. Do you have any advice of what I can do with 2 vials of sperm that I have that I can no longer use because my donor was not tested for something that I was positive for when I did genetic testing? So you can still maybe use it. I mean, the likelihood of you and the donor being genetically incompatible is about 1% or less. So, I mean, I don't necessarily, if you love the donor, I don't think it's a big risk that you would be taking by using that donor. But, maybe you can sell it back to the sperm bank. Some sperm banks will take back vials. So that's maybe one thing to consider. Okay. Let's see here. What's an acceptable progesterone level on the day of the trigger in an egg retrieval FET cycle? I mean, again, it's just the full picture of things, but I've even triggered with a progesterone level close to 3, and everything has been just fine. I've triggered at 1, I've triggered at 0.5, I've triggered at 2, so there isn't really a magic number. Let's see here. And yes, someone's asking me about supplements. If you go to my website, draimee.org, you can just put egg quality supplements, and you'll see an article that I've written with all of them there. Can you please give us your email address? No. Just kidding. It's on my website. Also, do you suggest NAD over NMN? I just have more experience with NAD. NMN you can totally take too. I've had patients take it with great results. Let's see here. Thanks, Dr. Aimee. I'm in the stimulation phase for my elective egg freezing, and I've learned so much from you, and it's so helpful to feel like I'm not alone and have a community. I swear it. I know that's the best thing about hearing other people's questions and having me answer them, or even just not even like you guys can just zone out about my answers. Just be like, but just listening to other people and what they've been through just literally makes us feel less alone, literally. Hi, Doc. I'm 31, no issues. Husband's 32 with male factor infertility and varicocele, starting my first IVF cycle this month. Should we move forward with ICSI IVF or have my husband do varicocele surgery? So it just really kind of depends on what is his sperm DNA fragmentation test. I use that as a green light, yellow light, or red light. If his DNA fragmentation is okay, then it's like green light, use Zymot, Pixie, or something like that. However, if your egg count is low, then I would say go. If your egg count is high and you're okay waiting, get it fixed. However, the other thing that you can do is just fix the varicocele, still do IVF, and then baby number 2, you won't need me or a fertility doc like me. Let's see here. Next question. I'm 40 and I just had failed IVF. I had 5 follicles on my left and 2 on the right. 2 on the right only grew to 10 to 11. They collected 4 eggs, 3 good eggs, none of them fertilized. I was on the birth control pill for prep. That sucks. I'm sorry. Wendy is saying, if someone is hyperthyroid, low TSH, so off of levothyroxine, could doing a round of IVF drugs impact IVF? So the answer is, if you have low TSH and you're symptomatic from being hyperthyroid, we got to treat it before you do IVF. But for the most part, it shouldn't affect your egg quality. Let's see here. I'm a guy with a DNA fragmentation of 10%. Is that too high? No, you're a guy with a really good sperm DNA fragmentation. Sheila is asking, where can we buy the CoQ10 that you've previously recommended with code TUSHY? So go to Theralogix website, THERALOGIX.com. Go to that website and you can find the CoQ10 there. Just put in NEO, N-E-O-Q, and the number 10. And I have a funny cock story that I'll tell you guys one day, maybe next Friday. It's a good story. It's super funny. My doctor, I stopped seeing him, said that he thinks I might have poor eggs, but no way to tell besides looking at eggs under the microscope with IVF. Is that true? I'm 31, but I have PCOS and have had 3 miscarriages. Well, I mean, the reality is it's possible that the miscarriages are due to an egg quality issue, but how do we know we're not missing a structural rearrangement like a balanced translocation? How do we know we're not missing a uterine septum? How do we know this isn't a sperm issue and a chromosome issue on that side? So what I'm saying is, sure, egg quality could be on the list of problems, but at the end of the day, unless you look at an egg, you don't know for sure. But I would say looking at everything, making sure your PCOS is well balanced. And what I mean by that, all your hormones are balanced and healed, like your testosterone level would be really important. I'm 31 years old, 1 ovary. I've had 4 cycles, 2 top quality embryos frozen, 2 eggs did not grow. I'm averaging about 1 for each cycle retrieved, but last cycle was on, they gave me 450 units. Should I try Clomid and 150 again, or is there something else you suggest? See if you can try Femera instead. Okay, guys. So last question. My husband has XXY and I have PCOS. Do we have a chance of having a healthy baby? And the answer is yes. You would obviously want to make sure that your husband has sperm. Men who are XXY almost never have sperm. So if he happens to have sperm, you're really, really lucky. And there certainly are case reports of XXY men who have fathered pregnancies, but you really want to maybe consider doing genetic testing of the embryos as well. Okay, guys, thank you for joining me on my Friday night momlet edition of AskTheEggWhisperer.com. So feel free to send in a question there whenever you guys want, and I'll answer it as soon as possible. I love you guys. Have a great night. Keep sparkling. My heart beats for you literally every single day. And this is my life's work for obviously a reason. I'm slightly passionate about helping each and every one of you who wants to bring more love into not only your life, but into this world. That's extremely important to me. Thank you guys. Love you all.